Hello and welcome to African American Health Matters.
This is Ed and Pat Sanders with health tips and information because your health does matter. The information in this broadcast is not intended to substitute for personal medical advice. Now, before making any decision about your health, please consult a physician or a qualified healthcare professional. Our organization has over 103 partners across the country who are dedicated to patient education, advocacy, and finding ways to better access health and disease resources for African Americans. This broadcast of African American Health Matters is one of the health outreach tools used to reach millions. Thanks to Cyberstation USA, and thanks to you for tuning in.
African American Health Matters is a new mobile health text message and multimedia outreach that provides health tips and reminders to subscribers right over their cell phones. Our website, www.africanamericanhealthmatters.com, has updates and information about diseases, tips, audio messages, and later this year, video slices of doctors talking about critical diseases that affect African Americans.
African American Health Matters partners with events and conducts focus groups and surveys to find out just how African Americans are accessing their health information. There are critical numbers of African Americans dying from prostate, breast, lung, and colon cancer, but a lot of times it's treated too late. Now, even more African Americans are affected by diabetes, hypertension, asthma, high cholesterol, obesity, drugs, and alcohol.
And we're still needing continuing education and more information about HIV and AIDS. Our surveys show that we need more ways to access resources available in our community.
Yes, and Papa, do you know what? There's a staggering number of African Americans who are not aware of drug discoveries that could save their lives through clinical trials. What we need to do is educate more people about the importance of clinical trials.
I agree completely. Drugs that can be used on African Americans and tested in Africa, Brazil, or Jamaica is just not going to cut it. Rather than letting other countries test medicines that will be administered to us, we as African Americans need to have a say in the drugs that will be put in our bodies. And the only way to do this is to participate in new drug discoveries.
On this show, we'll have all kinds of health tips. Health tips for remembering to take your medication, tips on handling your diabetes, breaking those bad habits, and even inspirational health messages.
I was searching on the internet and I found Medline Plus, that's MEDLINE Plus, and they've got some videos online that are very, very interesting and talk about diseases and allergies and drugs, and it's really worth checking out. The website is Medline Plus, that's MEDLINEPLUS.com, and just check out the videos and cool tools.
Think you're addicted to food? You may be right. Researchers from Yale University wanted to know if some people's brains react differently to food, the way substance abusers' brains react to drugs. First, they asked 48 young women to answer a questionnaire to determine if they had symptoms of addictive-like eating behavior. Then, they hooked the women up to a machine that measured their brain activity while they tasted either a chocolate milkshake or a liquid with no flavor. Women who scored higher on the food addiction quiz had more activity in certain regions of their brain when they were expecting food. These regions play a role in urging us to eat and are the same parts that motivate people with substance dependence to use drugs. People with higher food addiction scores also had less activity in certain areas that help put on the brakes after a tasty treat. According to the researchers, food advertising could make it hard for some people to stick to a healthy eating plan because of the way their brains respond to the ads. I'm Dr. Cindy Haynes of Health Day TV with the news the doctors are reading, health news that matters to you.
Dr. C Ferdinand is a clinical cardiologist, previously medical director of Heartbeats Life Center, and a professor of clinical pharmacology at Xavier University, College of Pharmacy in New Orleans. He's going to talk about cardiovascular health, hypertension, cholesterol, and atrial fibrillation in African Americans.
Absolutely. Okay, let's start out with the heart disease. Just tell us a little bit about what is heart disease and how is it statistically affecting African Americans?
Heart disease is a general term for diseases of one of the most important organs of the body. The heart is basically a muscular pump that circulates blood to the lungs and to the rest of the body. Without a functioning heart, we simply die. There is no replacement other than heart transplant, which is very difficult to do, and mechanical heart replacement, which is very rarely done. So it's important to take care of your heart. When you have it working well, keep it working well. Now, the term heart disease can apply to the muscle of the heart. If the muscle of the heart weakens, that's known as heart failure. If the person retains fluid, becomes congested, it's known as congestive heart failure. And congestive heart failure is much more common in African Americans. It has an earlier onset and a higher mortality. Mortality is a scientific term for death. So African Americans get more heart failure, get heart failure at an early age, and die more from heart failure. Now, why is this the case? There may be some genetic factors, but most of it's related to the simple lack of control of risk factors. The primary risk factor that leads to heart failure in African Americans is uncontrolled hypertension. Starting at an earlier age, African Americans will have elevated blood pressure. If this blood pressure is not controlled, the heart may thicken, a term called left ventricular hypertrophy. After a period of time, the heart then weakens and eventually can fail. Another form of heart disease is known as coronary heart disease. And this is a disease of the blood vessels that lie on top of the heart and supply oxygen to the heart itself. The term coronary comes from the Latin for crown, because these vessels sit on top of the heart similar to a crown. The main coronary artery disease that leads to death and disability from heart disease is atherosclerosis. The technical term meaning the buildup of fatty deposits in those vessels. This obstructs blood flow through those vessels. If red blood cells with oxygen can't get through the vessels, the heart muscle dies. When you have blockage that's total, it's known as a myocardial infarction. Myo is M-Y-O. It stands for muscle. Cardio is C-A-R-D-I-A-L. It stands for heart. And infarction means death. So this sudden closure or total closure of one of the vessels of the heart is known as a myocardial infarction. The common term is heart attack.
Okay.
Heart attacks happen earlier in African Americans and there's higher mortality. Again, we don't think that genetic factors explain this. It's related to an elevation of cholesterol, more diabetes, perhaps more smoking in some patients, and less control of blood pressure. Hypertension not only can lead to congestive heart failure, but can also lead to coronary heart disease. Now, one of the important aspects of coronary heart disease in African Americans is that similar to heart failure, where the heart muscle becomes weak, coronary heart disease starts earlier and has higher mortality, meaning higher death rates. And these higher death rates may be related to the fact that many African Americans have less than ideal insurance status, have less health-seeking behavior, are less seen by specialists, and have less control of cardiac risk factors.
Okay.
So the bridging concept in terms of heart disease is that if you have a bad heart, it can lead to decreased life expectancy and a lack of ability to do everyday activities. But many of the forms of heart disease that we know can be prevented by control of risk factors, such as controlling blood pressure or hypertension, controlling cholesterol, controlling diabetes, and avoiding smoking.
Okay, Ken, I had a question for you. Do women of color need to worry about heart disease more than others?
Heart disease is actually higher in African American women than other female populations in the United States. African American women have a coronary heart disease mortality or a death rate from coronary heart disease more similar to that of white men than white women.
Oh.
And it is one of the reasons that African American women have decreased life expectancy. The rates of coronary heart disease are directly related to the poorly controlled risk factors, such as poorly increase in food consumptions of high caloric foods and fatty foods, but it also may be related to a lack of recreational activity.
Okay.
By that I mean just daily physical exercise. In surveys done of populations in the United States, the population based on gender or sex and race that has the lowest activity of everyday recreational activity is African American females.
Wow.
The reasons for this is not clear, but it does appear that this lack of activity, along with the consumption of high-fat, high-calorie foods, leads to an excess of overweight and obesity, which is a powerful risk factor for an increase of heart disease in African American females.
Wow.
I understand, doctor, that the heart is also divided into right and left sides. Can you touch bases on that a little bit?
Well, the heart actually has 4 chambers, and there are 2 chambers on the right side and 2 chambers on the left side. So the right side of the heart receives blood from the veins, and this blood then is pumped to the lungs. The reason the right side pumps blood to the lungs is because when we breathe in air, we're actually trying to get oxygen into the blood. So you want to have blood into the lungs to receive the oxygen that's breathed in when you take each breath. The right side of the heart then pumps the blood to the lungs. From the lungs, the heart then receives the blood on the left side, and the left side of the heart pumps the blood to the remaining parts of the body, including the head, the chest, the arms, the abdomen, and the legs. When we talk about heart attacks and people dying from myocardial infarction or death of the heart, we're mainly talking about the left side because this is the part of the heart that pumps blood to the brain, to the arms, to the chest. So if you have a heart attack and you can't pump blood to the brain, you can develop a stroke. You can't pump blood to the peripheral arteries. You can get gangrene or decreased blood flow to the periphery. Both the right and left sides of the heart are important, but typically when you talk about heart attack, you're talking about blockage of blood flow to the left side of the heart.
Okay.
Okay.
Now, does the heart rate increase or decrease as you get older?
Heart rate varies throughout life expectancy. When we are infants and young children, we tend to have higher heart rates. But then as we become teenage and young adults, especially if a person exercises and is conditioned, the heart rate lowers. People who play basketball or runners have resting heart rates in the 50s and 60s and sometimes even in the 40s. Whereas an adult who is deconditioned, which is a fancy way of saying out of shape,
Right.
has a resting heart rate in the 80s and 90s. As we get older, because of a decrease in activity, a decrease in physical fitness, you have an increase in heart rate, but it's not necessarily a specific component of aging. It's a marker for being deconditioned or out of shape.
Okay.
Trying to get my ladies back on track. Drop that weight before you have a heart attack. Oh, just like that. Okay, now let's go to work. Shoes, gym, shorts, shirts. Drop that weight just like a hurt. Okay, let's drop that pound cake. Don't look at me with a frown face. You know you need to get it right. Oh, got my cellulite. Let's get it right. I got that work. Drop it down, make it work. Pick it up from the dirt. 'Cause I don't wanna see you hurt. Ladies to the floor, pick it up, let's go. I don't wanna keep it in. I just gotta let you know. 'Cause I wanna see you live. I don't wanna see you dead. All my ladies, baby, red. Let's get your hearts right. Let's go. And move to the left, move to the right. Turn it around, jump up and down. Move to the left and move to the right. Turn it around, jump up and down. Get low, get low, get low, get low, get low, get low, get low. Bring it to knock your friend. Those cigarettes down, I recommend. If you die too soon, it will be a sin. Now wait, freeze, don't eat that. Fatty foods cause heart attack. Arteries hard like dental plaque. And when you die, you can't come back. Go red, rise, take control. Save your mind, body, and soul. It's never too late and you're never too old. Cross that finish line, take and go. Time for you to exercise. Work your booty, hips, and thighs. We hope that you recognize we're red. That's right, we're saving lives. Yeah. Let's go. I don't wanna keep it in. I just gotta let you know. Cause I wanna see you live. I don't wanna see you down. All my ladies wear me red. Let's get your hands right. Let's go. And move to the left. Move to the right. Turn it around. Jump up and down. Move to the left. And move to the right. Turn it around. Jump up and down. Get low. Get low. Get low. Get low. Get low. Bring it up. Bring it up. Now bring it up. Bring it up. Now bring it up. Bring it up. Now bring it up. Bring it up. Let's go.
That was Dr. Ronnie Whitfield's rap on raising awareness about heart disease. You can see the video by going to www.cyberstationusa.com/AAHM and click Let's Go.
Bunions are usually caused by prolonged pressure put on the feet by narrow-toed, high-heeled shoes that compress the big toe and push it toward the second toe. Over time, the condition may become painful as extra bone grows where the base of the big toe meets the foot.
We had a conversation with Dr. Angela Hill. She's a pharmacist and a consultant pharmacist and has been for the last 18 years. She's a professor, administrator, and a clinician who specializes in psychiatric and neurologic disorders, geriatrics, alternative medicine, and pharmacy communications at Florida A&M University, pharmacy at Tallahassee, Florida. Dr. Hill was very informative with regard to remembering to take medications. Many of our subscribers has asked for monthly tips to remember to take their medication, and here's what she had to say.
I'm going to switch up just a little bit, Angela. Does it depend on the individual, or just how beneficial is it to take a low dose of aspirin daily?
Well, that's controversial. Your higher risk patients are those who've already had heart attacks or who've already had strokes. Those are the ones we really, really, really want to take one. For a person, depending on the age of the patient, if they have family history of things like hypertension and those kind of things, there's a school that, it really won't hurt. But the problem is that when you introduce a medication to a person and they don't need it, you're exposing them to potential side effects, drug interactions, those kind of things that they may not have experienced. In the case of aspirin, it could range from just stomach upset to things like ulcer development or bleeding and bruising, depending on the factors associated with that patient. But there's a lot of data that talks about aspirin's protective effects from, again, cardiovascular events like heart attacks and strokes. So the preference is to talk to your doctor about whether or not they think you're a candidate for it, because there are tons of benefits, but and it is a cheap medication. It doesn't cost a whole lot, but in some cases we have patients that are actually allergic to aspirin, and or there are other more appropriate drugs that may address other medical problems that they have. So we don't just want everyone walking around on an aspirin a day.
Now, speaking of aspirin, which is a non-prescription medication, there's so many non-prescription meds on the market. What would be your general recommendations that you'd have for folks just buying OTC? I'm going to give you an example. I have a friend who has a stomach condition, and rather than taking the medication, or after she ran out of the medication, she just got something over the counter. How would you balance this intelligence about over the counter, OTC as they say, medications?
Well, there's a couple of rules, three general ones, that consumers need to be aware that non-prescription products are not really intended to do much for us. They're really what we call for short-term use. So some say 3 to 5 days, 3 to 7 days. And if the problem persists, they really need to see, medical care to make sure diagnosis is right. Because our perception of what's going on, might be confirmed through lab work and other testing, when we go to the doctor. The other thing that should happen is that consumers should really capitalize on the availability of pharmacists and stuff so that they can make sure that the non-prescription product won't, as I said earlier, complicate other medical problems they have. So sometimes when they go blindly pick up something, even though it's what mom's always used or dad's always used, every individual is unique, and sometimes there are certain precautions. And if you read the labeling on a lot of these products, it'll tell you if you're pregnant or have high blood pressure or have diabetes, et cetera, talk to your prescriber to make sure that you can afford to take the medication. But one of the biggest risks is that consumers really shouldn't use these products to substitute chronic problems.
Yes.
Because they can actually aggravate issues, and then it delays treatment, and sometimes people run the risk of experiencing complications that they wouldn't have had had they got diagnosed earlier. So you don't want to run the risk of self-treatment, It's always more appropriate to get an adequate workup to make sure that you are dealing with the same thing. And I can tell you an extreme example where a person thought they just had reflux and they actually were experiencing a type of seizure. I've seen the other thing happen on the other where they thought they were having a seizure and it turned out just to be reflux. But there's no mechanism, when you're inside a CVS and you pick up Zantac, the Zantac will help control that reflux. But if it's something as extreme as a seizure, the Zantac would not help that at all.
Yeah.
So that's that's some of our concerns here.
Yeah.
Now, can you tell us a better way to sleep without taking medications?
Yes, the kicker to sleeping without needing medication is, first, if we start with going to bed and getting up at the same time, that always helps. Then the other thing is preparing the environment for proper sleep. So that means minimizing noise and lights as much as possible. And then the other part of the environment is making sure that when you get in that bed, you're doing what you should do in a bed, which is either sleep or intimacy. A lot of people like to get in bed and read.
Yeah.
Get in bed and eat.
I do.
And those kind of things. But what happens anytime you put the body in a position that implies you're lying down, there are processes between the eye and the brain that says we're getting ready for sleep. So when you get in and you're reading your book for an hour or 30 minutes or two, you fool the brain, and it's not sure exactly what you want to do.
Wow.
So you have to be very careful about what you actually do when you're in a lying position.
What about television, looking at TV?
The problem with the TV is that the lights are actually very stimulating, and they can actually, again, fool the brain. There's a switch literally in the retina of our eye where when we adjust the light in about 20 to 30 minutes, there are hormones, melatonin being one of them, that start being produced that tell the brain, okay, I need you to start shutting down. We're getting ready to go to sleep.
Okay.
And so when you watch TV, what happens is that light is still blinking, so the body is thinking, I need to be awake. No, I need to go to sleep because I'm lying down. So that can sometimes interfere with your ability to get to sleep initially. And what we're attempting to do is try to make sure that you sleep within 30 minutes. Outside of that point, that's when we start thinking it's a disease-type position. But under normal circumstances, without light and lying down and no noise interruption, we typically should be asleep within 30 minutes.
Okay. Now, onto the medications. I was going through my medicine cabinet the other day, and I found medications from 2007, 2008. And there was like a half a bottle here. I mean, how would you address this? I mean, there are some, there are lots of reasons I'm sure people would have, one being financial. If they find a medication and they've got a cold and the doctor recommended this particular pill a year ago and they still have some, I'm guilty.
Well, there's a couple things that happen. We do commonly, people are starting on antibiotics and they don't finish the prescription, and all kind of things happen, and we just hold on to it. And I have a lot of people that buy the 500-count Tylenol, and then they never finish it, and they look, and they still got this big bottle with a couple hundred or a couple in it, and they've expired. So there are some things we could do. Very few areas now, unfortunately, have collection sites that'll collect unused or expired medications. Some pharmacies do it. You often will see drives, where once a year or twice a year places will do it. But hospitals and places can't really collect things because there actually is a cost to have it destroyed. Usually it's just incinerated somewhere. But what consumers can do at home is actually prepare it for household disposal in the garbage. And just some general rules, if it's a solid medication like a tablet or a capsule, you can actually crush it and put it in something like coffee grounds or fertilizer or dirt. And
recycle it.
Yeah.
Wow.
Well, you don't want to necessarily put it back in flowers and that kind of thing, but maybe just put it in a bag and then it's ready for household trash. If you have a liquid formulation, you can dilute it with water and also pour it in some of those same substances, but keeping it away from the sink or the toilet. When you have a patch, we suggest people fold the sticky sides together, put it in either the same foil wrapping or packaging. Make sure you always deface containers that have names and other, important patient-related information on it, but you can repackage it and put it in the garbage. If you have an inhaler, you can get that silver tape that covers everything.
Right, that packing stuff, yeah.
Above the inhaler, and put it in the garbage again, defacing it as much as possible. And I always tell people too to use things like those Maxwell House coffee cans, the ocean spray bottles or the bleach bottles, wrap it in that silver tape, and you can fill up that, and that's a homemade sharps container.
That's true.
Once you make sure people can't see through it, you can put it in the trash, and it'll be, it'll protect. Our concern here is we don't want children and pets, or people to be exposed to things inappropriately. So those are a couple of things that you can do. Ointments and creams, all of those can again be squeezed into some of those substances the same way.
Okay.
So there's all kinds of options, but we just really are concerned about our wildlife and reproduction
yes.
issues as
Yes.
well, because the water supply is affected when medication ends up in it.
We want to thank our partner organizations, Colon Cancer Alliance, www.ccalliance.org, American Heart Association, www.americanheart.org, Susan G. Komen, www.circleofpromise.org, National Foundation for Continence, www.nafc.org, and you can find our web partners on www.africanamericanhealthmatters.org. Be sure to tune in on Fridays from noon to 1 to African American Health Matters on Cyberstation USA.